My second question is, how do you think COVID will further impact the health disparities, specifically in heart disease and obesity, since COVID impacted minority communities heavily? If so, are there going to be any future accommodations that put in place to combat this?
Well, that's a further extension of a good question there, Samantha. That at least there are a couple of directions to go there. One of the things that is still a bit of a mystery is that we're acquainted with the acute effects of the viral infections, respiratory spread, particularly affecting the lungs, causing a pneumonia, and making you sick in that way with a lot of respiratory sorts of symptoms. And an acute sort of infection that's similar, let's say, to a severe case of the flu, that then passes as the virus gets cleared by our body's defense fighting it off. But one of the elements that has started to emerge is the notion that after the acute infection with COVID-19 and the disease is there, that after that acute phase, there can be this lingering phase, even during convalescence, even during recovery, in which individuals still complain that their symptoms don't go away, even though the virus has been cleared from their system, apparently. And so these post-acute COVID syndrome, some call it long COVID, where they're even 6 months out, they're still having the consequences, the sequelae of having been infected 6 months prior. And there's evidence that maybe some of those abnormalities I described before, where your blood clotting system is kind of hyperactivated and you form more blood clots, that appears to persist. Again, well after the acute infection appears to be gone. And we're still actively studying some of these individuals who complain of long COVID. Some of them call themselves long haulers, to really understand what's the spectrum of disease. Why do some people have persistent symptoms and some people recover fully? There's a lot that we're still learning about this novel coronavirus in that regard. We don't know as much yet as to whether those who had predisposing, let's say, heart disease, then develop COVID, whether that puts them on a different trajectory with more steeper and severe decline in that function. Those are some of the things that NIH is actually launching right now as a study of the post-acute sequelae of COVID. So that's one element that could persist, and we actually don't know, quite frankly, right now, the numbers of the relative prevalence of these post-acute effects amongst different subpopulations of the elderly or communities of color that have been disproportionately affected for acute, whether that still follows through for some of these long COVID sort of problems. So that'll be something to watch. Similarly, as you kind of alluded to, if indeed there were these inequities and health disparities that emerge with COVID-19, what happens, after vaccination, after we get on the other side of this, what happens in that context? And I think that's, again, a very insightful question and point where it'll be critical for us to see what could we be doing now that could render these same vulnerable communities more resilient to these kinds of threats in the future. Unfortunately, this SARS virus is not entirely new. We had a similar sort of cousin of it 10 years ago and another cousin of it 10 years before that. So this may not be the last pandemic. And so it'll be critically important that we prepare those communities that are most vulnerable now in ways that may help them be more effective and resilient to not being so devastated. Some of that may involve addressing the underlying health inequities of that led to it, whether it's the social determinants of health, the fact that so many of them are essential workers, and we didn't get the protection to those essential service workers as quickly as we needed to in retrospect, and so that we could do better. Similarly, perhaps treating some of those underlying conditions, the hypertension, the diabetes, more effectively, shrinking those inequities, again, could make them healthier communities that are less likely to be devastated by a similar pandemic should it happen again. So those are a couple of things that we hope these lessons learned will help us in addressing health inequities in the future.